Dr. Dobbs, thank you so much for your willingness to take time in this very busy season to have a chat about children. We really want to discuss several topics regarding children from a public health perspective, and we know of no one better than you in Mississippi to speak about this. I'll just kind of get it started by talking a little about the importance of public health. We know that it is really the foundation. Health is the foundation of a thriving community, and public health really works across all sectors of the health community, and never more so than over the past 7 months. So we know that some people have used a GPS navigation system as sort of a metaphor comparing public health, using the information and the data that you have, surveillance, contact tracing, whatever your methodology might be, about what are the best routes to get to a final destination. In this case, the mitigation and decrease of COVID. And so then finally, we're also thinking about public health as a great investment. If we know about a return on investment and funding opportunities, the pandemic, COVID-19 has certainly pointed that out when we're thinking about the public health side of preventing hospitalization, increasing longevity. And we know generally that a high percentage of the leading causes of death are also preventable. And so increasingly the importance of having a strong, funded, robust, fully funded, robust public health system is just of utmost importance. And so, Dr. Dobbs, again, we thank you for being here. And I think you have some information that you'll be sharing as far as an overview of public health in Mississippi and what you are currently doing. So thanks again.
Yeah, thank you so much, Linda. And I'll go ahead and before I start my presentation, I would like to say thank you for bringing attention to the importance of public health. In the United States, not just Mississippi, but certainly Mississippi as well, we've made some false assumptions about health and well-being. And where I think that, well, I know that we've made a mistake is we've assumed access to healthcare means health. It means a healthy community. And we have decided to invest every single available resource into healthcare and have decided, therefore, that there's no need for public health anymore. And nothing could be further from the truth. If you look at public health funding across the country, it has plummeted over the past several decades. When we look at even our nursing workforce in the Department of Health, compared to 4 years ago, we have less than half the nurses we had just 4 years ago. Because,
oh my goodness.
Oh yeah, and so you know, people have, you know, community health centers, and I think they're fantastic entities. But because we have community health centers, because we have more people with insurance, it's just decided that public health isn't relevant to a lot of folks. But public health does something very different. It's not an or, it's an and. It's a complementary thing. You can't have a healthy community without a strong, robust public health system. And why is that? Well, for one thing, you need someone to fill the gaps, right? So
Yes.
When you think about communicable diseases with the coronavirus stuff, your doctor's office is not going to do a case investigation and outbreak investigation, right?
Right.
The doctor's office is not going to be able to stand up a massive immunization campaign for 3 million people, right?
Exactly.
So there's all those sorts of things. But the other thing that's extremely important is the prevention piece. If we think about all the money that we put into healthcare, it hasn't gotten us one iota better on our global health because we wait until people need a kidney transplant, or wait until people are hospitalized with a stroke before we start investing in health. We need to think upstream. We need to prevent the kidney failure. We need to prevent the stroke. And we have got a very backwards mindset about what health means or what health system should look like. So just thanks for bringing that up, because we do get a lot of bang for our buck when we think forward about preventing these things and let people have long, productive, healthy lives, rather than pouring every available resource into years of people who are under disability because we haven't prevented folks from getting sick in the first place.
Yes, and what better topic to think about that for the long-term benefits for children's health. When we think about the developmental nature of children and how we can have best practices early on in a child's life, and whether that's through vaccines, etc., the long-term health benefits of that. So thank you so much for making that point as well. And my goodness, the expansiveness of what is needed across the state and across the country in public health has really been reinforced over these last 7 months. So thank you. And so now we'll talk about the COVID-19 and what the health department is doing, and a particular focus on children. So thank you.
Yeah, well, thanks again. And I'll go ahead and go over some of the background stuff, and then we'll sort of shift the conversation more around coronavirus and children.
Thank you.
If you can see kind of where we've been as a state, it's good to look back over our history, and there's a few things that are a better demonstration that sort of our epi curve, or the number of cases we've had over time, and then the impacts of that. Our first reported case was in March 11th, but then retrospectively we looked back and did find some cases back into February, and you can remember early on, and we all can remember it because it's very traumatizing when all of a sudden we had cases in Mississippi and everyone was concerned, and we're getting calls about, I've got a package from China, can I open it? I mean, our level of anxiety was really, really high.
Yeah.
And so we had an increase in cases going through March, and this period of time was marked by a lack of testing, a lack of protective equipment, a high degree of anxiety, a high degree of uncertainty. So clearly the number of cases we all saw here are an undercount because we didn't have testing capacity like we do today until we started going into May. So probably if I could make this curve, it'd probably be more like that.
Yeah.
And if I could, or maybe even like that. So going into April, we did have the sort of shelter in place. Now keep in mind, Mississippi never really closed the economy. We just really had a significant slowing by restricting, restaurants and stuff. We certainly did that. But we had actually a really good response. And we actually flattened the curve, and actually we're on a pretty good downward trajectory going into the summer. But when we hit Memorial Day, everybody decided that they were done with coronavirus. It's no longer a concern. And boy, that couldn't have been further from the truth. And then we had this summer surge. We had a big blip after Memorial Day. We went into the 4th of July, and then another pretty significant jump. But fortunately, I think we kind of learned our lesson and started behaving a little bit better. And we could see a pretty significant drop in the number of cases. If we think about when we did certain things, we started the mask mandates around the mid portion of July, when there were some of the big counties and the high incidence counties that accounted for the majority of cases were under the mask mandates and social distancing procedures. And we did see a bending of the curve related to that, but also related to people making the individual decisions to do the right thing. We can see also this reflected in our deaths. Early on, also, obviously, we had a preponderance of deaths within the long-term care settings. These are the deaths in basically the nursing home setting. We had that pretty good improvement coming into the summer, and deaths are going to lag cases. So, the improvement's going to lag a little bit. But then again, when the summer, we had a pretty massive increase. And you can see going into the summer or midsummer, it was actually more non-nursing home folks than nursing home folks. Reflects some of the aggressive measures we had going on to protect nursing home patients were effective, but just with a sheer number of people in the community with coronavirus, absolutely kind of found the chinks in our armor, and then obviously had those bad outcomes. But again, we're improving right now. But I do think right now we're kind of going to be in a flat phase. We're going to report a good number more cases today than we did yesterday. Then let's look at the age groups that are affected, and this is very, very telling. We actually haven't had all that many cases in people over 60 comparatively to the younger age groups, but the majority of our deaths are in these older age groups. And if you look at people 90 and above, we're really looking at about 1 in 4 people dying if you get coronavirus. The mortality rate is absolutely astounding, and then it does improve proportionally as you kind of go down the age ladder, but we still have a significant number of deaths in young adults, and we have a death in a young child. And I'll talk about that in a second. But you can see the preponderance of cases that we do see are going to be in younger folks, especially teenagers and sort of the more sort of social gregarious sort of people in their 20s who want to go out and have parties and see friends. And that is the perfect recipe for spreading coronavirus. A bunch of people, especially if you're drinking alcohol indoors, having fun, in close proximity is the most perfect way to spread coronavirus. And certainly we've seen some pretty remarkable outbreaks within this age group. And if we look at what's going on, like in Oxford, for instance, it's like 80% of their cases are going to be between the ages of 18 and 23 for obvious reasons, right? It's going to be, the college town, and that's the age group of folks who are out and about doing stuff. Let's look a little bit more at our kids, and we see a lot of cases in teenagers. And we do know that teenagers are just as infectious and just as likely to get the virus as adults, young adults, and then older adults. So teenagers are really good spreaders of coronavirus. They're really good spreaders, probably partly because of the physiology of the kids at that time, but also, they're more social, they're active, they're having sports, they're, doing little parties and stuff. So they're going to be pretty good spreaders. But if we get into the younger age group, we do have a smaller number of cases. And there's several thoughts about that. One of the thoughts is almost certainly, they're not going to be quite as socially engaged as the older kids, right? So they're not going to be around as many people. But with all of our different measures, we've actually had kids out of school. A 5-year-old's not going to hop in the car and go hang out with his buddies, at the sandbar, right? The 5-year-old's will stay home. And so we've isolated our young kids, and we haven't had that many cases. But the other thing that's interesting about young kids is we think they're not as contagious. They're probably just as likely to get it, but they don't get very sick. And we think they may not be as contagious. We still don't know exactly why that is. Is it something about how we interface with children, or is there some biology to it? Because we know kids actually have a pretty significant viral load in their nose when they get, it even seems to be more than adults, but they just don't manifest the same symptoms.
Well, that's a good news.
Yeah, and it may explain, and this is something we'll still learning about, why we haven't seen devastating outbreaks in childcare settings. Because we never closed down childcare in Mississippi, right? We did have people voluntarily cut back as far as like their operations, but there was never any mandate to close any sort of childcare center.
Right, and it was important for primary and first responders as well to have places to keep their children.
Absolutely. But sadly, we did have a death in a young child between the ages of 1 and 5. This was a perfectly healthy kid who got coronavirus and ended up getting this Missy thing, and I'm going to talk about that in a second, so you can understand what that is.
Okay.
So Missy is multi-system or multi-organ inflammatory syndrome in children, and basically it's almost like kids get COVID and then they start getting better, but then the immune system takes over and basically attacks the body, and it can be deadly. And you can see we have 792 confirmed cases of Missy in the country. We have 16 deaths, and Mississippi has 2 deaths reported from this. Now, most kids are between the ages of 1 and 14, but you can be older, you can be younger, and it seems to be disproportionately in Blacks and Hispanic folks, but that really more reflects the proportion of Black and Hispanic folks who are impacted compared to Caucasians. It is from COVID, there's no doubt. It's a reactive phenomenon that occurs after coronavirus infection. And in Mississippi, you can see the Missy deaths, the Missy cases that we've had. We've had 6 cases and 1 death, 1 to 5, 2 and 6 to 10, and then we had a teenager who died from Missy as well. One of the things about just the medical stuff about kids I do want to mention, and this is something for teenagers that I think we're going to have to watch really closely, especially youth athletes. Within teenagers, there's a recent study in the New England Journal, in JAMA, that looked at student athletes who had COVID, because one of the concerns is the coronavirus is not just a respiratory virus, it's an every organ virus. It infects the bloodstream, infects the blood vessels, and a large proportion of people actually get heart inflammation, or what we call myocarditis. And in the recent study, 15% of kids who got coronavirus manifest findings of myocarditis on MRI scans. And so that's, kind of scary when you think about it. Now,
and Dr. Dobbs, if I may, that so much of the information you just shared, but that one particular fact tells us what a difference it is between coronavirus and regular flu.
Oh gosh, it's just not, it's apples and watermelons. It's just not.
Right. But we hear about that. But when you start looking at the data and hearing what you just said, that is a fact that is extremely sobering.
And it does worry me about youth sports actually. And I'll be straight up honest with you. I think that we have gone overboard with restarting youth sports. Um, uh, I think that we've over prioritized the importance of it right now, and we haven't been patient, like we talked about patience a little bit ago. Um, Now, I will say we haven't seen one thing that you worry about this myocarditis or heart inflammation is it's the second leading cause of sudden cardiac death of kids in the sport arena. There's a genetic thing that's the leading cause, but if you have this inflammatory thing, we do know that it predisposes kids to sudden cardiac death, which is scary. I know we haven't seen any of it, so maybe it's going to be super duper rare, but we're learning so much going forward. Obviously, it's something to be concerned about and to watch closely. And you know what they're doing in the SEC or in college football is if you get coronavirus, they're doing a sonogram and a heart MRI before you can go back to play. And we're not doing that with our student athletes in high school, are we?
Not that I know of.
We are not. We are not. So I just do hope we haven't overemphasized the importance of restarting youth sports too soon.
Okay. All right.
And then if we just look at this multi-organ inflammatory syndrome of children, you can see sort of like it's almost like bell-shaped curve, and kind of 5 to 9 is kind of the sweet spot of people who are going to have it. The syndrome is very similar to Kawasaki syndrome. Any of you guys are familiar with it? It's kind of like an inflammatory post-infectious thing, we believe. We don't really know what causes it, but it has a lot of similar manifestations to Kawasaki's disease, if you're familiar with that. It's not the same. It's not the same thing.
And it does show the smaller percentage the younger the child is.
Right, less than 1. It's small. But you know, this doesn't necessarily account for the differential risk of getting it, because we do know that the younger kids, right, are going to be less likely to get it. So proportionately, it might be higher if we do it by age category.
Okay. Okay. Yes.
Let's talk a little bit about mitigation strategies, and I'm just going to talk a little bit more in the context of being safe in school or in a child care setting. Some of these are CDC things, and some of them are going to be from CDC Foundation. We know we want to promote behaviors that reduce the spread of coronavirus, right? We want to maintain clean and healthy environments. Healthy operations are so important. One of the things that we've observed time and time again is that if we have an environment that's organized, where we have structure, we feel like that the kids are going to be really pretty safe. But it's when we lose that structure, when we let sort of like micro chaos ensue, social events, or sometimes athletics, or just spots where you don't have people spaced carefully and wearing a mask. Those are going to be the things where you get in trouble. I know it's annoying having to even think about that, because we know socialization is such an important part of development. But we know that from a COVID health perspective, the order is a big way to prevent transmission. And then so also having preparations when someone gets ill is going to be very, very important. So what are the risk factors for getting coronavirus? And so I do want to go over the different components of risk and what we can do to prevent the transmission of coronavirus, really in almost any setting, but these things are really mostly or uniquely helpful when we think about or a child care setting. The two that are going to be most important, we think, are going to be how close you are to someone, and then how long you've been around that person. And the distance that we've decided is probably a pretty good cut point is 6 feet. So being within 6 feet for 15 minutes or more is going to put you at risk of being an at-risk or even a high-risk contact. When we think about the spread of coronavirus, we have learned that it's mostly through basically breathing someone else's air. And so if you're close to someone, you're more likely to breathe in the infectious particles that they have. The tricky thing about coronavirus, especially for kids, is a large proportion of them will be asymptomatic while they're while they're contagious. And so that's one of the reasons why we have to take all these special precautions to make sure that we almost pretend like everybody has it, because anybody could have it. And we need to structure our behavior such that we assume that anyone we encounter could possibly be contagious with coronavirus, but also assume that I myself could be contagious and do not want to spread it or undermine the integrity of the workplace or the school or whatever. Um, Certainly surfaces are important also, but probably not nearly as important. But we do want to make sure that we clean surfaces with approved disinfectants so that we can minimize the transmission through that mechanism. Other factors that are very important, congestion. When people are clustered together, like going through, like say maybe a doorway or getting on a bus, or if we think about in the high school situation, one thing that really worries us is when people come and go and they go through the gate, right? So they're going to be bumping into each other. Group size is important. Group size is important for several reasons. First off, if you have a bunch of people around, it's going to be more likely that one of them has coronavirus. And probably right now, about 1 out of 100 people that you will encounter is going to be contagious with coronavirus. So if you have 100 people, it's likely you'll have somebody with it. If you have 10 people, the odds are going to be a lot lower. But also, if you have a small group of people, your outbreaks are going to be a lot smaller, and so the impact is going to be much less severe. Respiratory output, people singing, speaking loudly, are going to expel a lot more infectious material. There was an incident in Washington State where they had one choir member gave it to, I think, 60 people.
Yes.
In a 2-hour choir practice. So
yeah.
we do feel like that's a pretty good risk factor, thinking about, we don't want our kids getting together and singing, as cute as it might be. And then movement, certainly ordered movement versus chaotic movement, which sort of mirrors this congestion sort of concept as far as like keeping properly separated. And here's sort of like basically, if we can just think about what's lower risk and what's higher risk, and this is a decision matrix that we have used primarily with K-12 to help them design their prevention strategies when getting back to school, but it's applicable to just about any setting. And certainly we think of that if you're, this is backwards, it should be greater than 6 feet and less than 6 feet, but if you're more than 6 feet away, you're going to be safer. If you're less than 15 minutes, you're safer. Smaller group size, low congestion, directed organized movement is going to be safer. Low touch surfaces, but if you have those, then you clean them, and certainly respiratory output. So the most dangerous thing would be a bunch of people close together for a long time in a big group with chaotic movement, touching each other all the time and singing. So whatever environment that is, let's avoid that. But basically, just doing the simple things to stay away from folks and wear a mask is going to make such a big difference.
Well, and it certainly has in our state, because as you mentioned earlier and saw the graphics, the numbers have come down when we've started the statewide mask mandate in smaller groups, et cetera. So thank you. This is extremely important information. And a lot of it seems to be, because it's been said so many times in the last 7 months, just pausing, taking a step back to say, okay, does it meet these decisions or not? And how much individual families and communities can set things up to kind of control this. Is that right, Dr. Dobbs?
Yeah, it's really in our control. And that's one of the things that was especially frustrating early on, because, every conversation has become binary almost. And it's not really a binary conversation. It's really a conversation of what are the simple things that we can do to live the most normal life possible. That's really where we need to be, because we got to educate our kids, right? We can't live in a cave for 2 years. I mean, no one with their right mind would think that that's a good idea. We got to go to work, right?
Yes.
And we have to have some degree of fun in life, or we'll be depressed, and we have to be able to take care of one another. So there are safe ways to do all of those things if we're considerate of it, but it actually makes it a lot easier if everyone does it all at the same time: a mask, a distance, a small group. The governor has a saying that I really love is that right now 90% of people can do 90% of what they want, and everybody can't do everything they want to, and some people are just mad because they can't, right? And we have a lot of this sort of lashing out sort of behavior. But we know what works, and if we can just hold the course until we have a good vaccine, we can weather this quite nicely.
Right. And if not for your individual, what you want to do, what that's going to mean for children in this state and for their futures, as we mentioned earlier. So to me, I really think it's a gift we can give one another during this time. And people have said we can really come together, support one another by staying apart or by going through these decisions that we really can help one another and then shorten the time that we can get to that 10% that you mentioned the governor's spoken about.
Yeah, no, there are ways to do it. And that's a good time just to switch over and talk a little bit about what do you do like if we have an infection? How do we prevent new cases? And this is a really important component of what we can do. Um, so, and this is actually taken from the child care guidelines, and a couple things about that. So if someone has coronavirus, they need to isolate themselves, which means they need to stay away from other people. And we are changing this to 10 days, but the guidance still says 14 days, so I left it this way. But so if someone has coronavirus, they need to go home and stay away from people for 10 days, unless they're sick and they need to get seen by a doctor if you're short of breath or, real high fever and stuff. Obviously, you might need medical attention, but stay away from folks so you don't spread it to people. People are going to be considered contagious from 2 days before they develop symptoms, and then for 10 days after that. So a total of about 12 days is the infectious period for coronavirus. You notice I said 2 days before symptoms, right? And that's why it's so important to think about anyone could be contagious. And it's probably at that period before symptoms when people are most contagious, or right when they're developing symptoms. And one of the things that's really tricky about coronavirus is, and we see this time and time again, is someone starts feeling bad and they get a little cough and they got a tickle in my throat, and they think they just have a little allergies or something like that, and they blow it off. And in some of the outbreaks we've seen, people will actually go to work symptomatic, but they just blow it off or make excuses of what it is. If you have respiratory symptoms right now, there's a decent chance, no matter what your symptom is, that it's coronavirus. The other thing I want to say is, if you lose your sense of taste or smell or both, you have coronavirus. You just do. And you just stay home and get tested. And if your test is negative, test again, because you have coronavirus. It's just something that's really unique about this, because remember we talked about it's not just a respiratory virus, it's a multi-organ virus, and it kills the nerves that let you smell and taste because it invades those guys. The other thing is, if you test positive for a coronavirus, don't test yourself again. Wait your 10 days, and if you're 10 days, you need to be feeling better by then and afebrile, but wait your 10 days and then go back to work. Why?
Okay.
That seems like you would want to test, right? To make sure you're all clear. But it's really just more of a functional thing about how the test works. Most of the tests that we do look for the genetic material of coronavirus, or the RNA, which is basically the sort of cousin of DNA. But that RNA will stick around for weeks and maybe months. And it doesn't mean you're contagious. It just means that there's basically some genetic dust left over from your infection, and it's going to confound you and confuse you and make you angry, because early on we try to use this as a mechanism to keep healthcare workers out from from infecting folks, and we'd have healthcare workers out for 6 to 8 weeks, and they felt perfectly great, and they were so frustrated for good reason. But we've learned more about coronavirus and understand that you're really going to only be contagious for the most part for those 10 days for the vast majority of people. But this genetic material sticking around is not unique to coronavirus. It's the same thing with flu. And it's the same thing with tuberculosis and other germs, because the genetic material will kind of sit around almost like a remnant of the infection. We just never retest people for flu, right? You get the flu, you get better, you go to work.
Right. Well,
Yeah.
this really is enlightening. Thank you for sharing that.
Oh yeah, you bet. And like tuberculosis, we have people that a year after they're treated and cured, it'll stay positive. So it's something you got to be really thoughtful of. So a contact, what is a contact? A contact is someone who's been around a patient with coronavirus, and they may get it in the future. And this is a very important distinction. So Linda, let's pretend like you have coronavirus. And heavens, we'll hope that you don't have coronavirus. But let's say that you and I decide we're going to have lunch together. And I sit with you at lunch, and we decide, well, it's time to eat. So we take our masks off, and then we decide, because it's mealtime, it doesn't matter. We can just visit and talk, right? Well, first thing I like to say is there's nothing magic about drinking something or eating something that protects you from coronavirus. We see this all the time where people are in meetings and they're separated and they're in chairs and they're 6 feet apart and they're wearing masks, and you bring out some food, masks come off, and it's just like the watering hole in the Serengeti. I mean, people just kind of cluster around, and that's where the outbreaks happen a lot of times. So anyway, I got a little bit diverted, but
Well, it's
mealtime,
part of our culture too.
yeah, it is. And meal times and snack times or break times are really a vulnerability for us because for some reason we just naturally let our guard in. But anyway, so I had lunch with you, Linda, and then say tomorrow you get diagnosed with coronavirus. And so you were in your asymptomatic spreading period. That means that I'm a contact. And I'm a contact with you because I was within 6 feet of you for more than 15 minutes. And so what that means is that I might get sick anywhere in the next 14 days. Usually it's going to be within the first week, but sometimes it can be up to 14 days. And so that means is I need to step back and quarantine myself away from other people so that I don't get sick and spread it to them before I know it, or maybe I'm an asymptomatic spreader. And so me taking myself out of the equation stops another layer of transmission in the future. And if there were 5 of us having lunch with you and we were all exposed, all 5 of us would need to quarantine because that's going to be the shell that's going to keep it from going from you to 5 to 10 to 30 to 100 within the course of a couple of weeks.
Right, the whole multiplier effect. And so then obviously then I would, if I had it, would have to go back and say, well, who did I see that morning? Right?
Yeah, exactly.
Mhm.
And that's what we do in contact investigations is see who people are exposed to so that we can do these quarantine guidances. People get frustrated by quarantine because they feel fine, and they want to do what they want to do. And in the school setting, I know that the parents and the kids are frustrated because they can't do stuff, but they may get sick up to 14 days. But also they may be asymptomatic spreaders and not realize it. One of the questions that comes up all the time is, well, what if I get a test? Then I don't have to quarantine anymore, right? That's not true because we know you can go up to 14 days before you start getting sick. So if you're exposed and then 7 days later get a negative test, it doesn't mean that the virus is not going to pop up on day 14. So you can't test out of quarantine. We certainly think it's a worthwhile thing to do to test because then if you have a case, then you can look around people around you. But this is an extremely important part of our response. And at this point, we've had a pretty successful school opening. We have about 3,000 kids on quarantine, but the number of cases we've had and the number of schools that have had to revert to all virtual is very small. So I would say that it's a demonstration of how effective it can be when implemented properly.
Yes. I mean, that is standard public health practice, right? It's going on with other outbreaks and diseases for decades.
Mm-hmm. But quarantine, I think, really refers to 40 days. So at least we're not quarantining folks for 40 days.
Yes. Okay.
Consistent with the root of the word.
I guess I was thinking more about the contact tracing and surveillance and
Oh
that
yeah,
sort of thing.
yeah, absolutely. That
Yeah.
very much syphilis,
Tuberculosis.
HIV,
Yeah.
tuberculosis, yeah, all those communicable diseases, absolutely. So an outbreak, what is an outbreak? An outbreak is defined as 3 or more cases within a group, and it would be 3 or more cases, let's say, within a child care facility. And the thing about an outbreak that's worrisome is if you have this many people at the same time, not only is that too many people, but it means there's a lot of other people in that group that have it that don't know it yet, or have it and are spreading it asymptomatically. And so that's like an alarm bell that says, hey, we got to do something new. And so if you do have an outbreak, then there are additional measures that need to occur. And by and large, we will recommend that everybody in an outbreak, especially in the school, will go ahead and quarantine. Although we do have specific guidelines in our child care recommendations. So I encourage you to look at those if you're in a child care center to understand sort of what you need to do, cleaning and isolating folks and quarantining and that sort of thing.
And again, that's all on your website.
Yes, it's on the website under our prevention guidance for COVID-19.
Okay. Great.
And Linda, that's all I had. There's a lot, that's a lot of stuff to talk about, a lot of technical things and a lot of practical things. Um, so what do you think? What other questions do you have, Linda?
Well, thank you for such a wealth of information and for all the work that is continuing on. But I do think that some of the questions that have come in now that we're approaching flu season, while COVID cases are still ongoing, some people have termed this a twindemic. How concerned are you about that in Mississippi? And when should people take a flu vaccine?
Yeah, we strongly recommend everybody get a flu vaccine. If you're over 6 months of age and don't have any real contraindication, you need to get a flu shot. Even if you have egg allergy, there are vaccines that don't have eggs in them. You can get a flu vaccine. So please get a flu vaccine. And what are the reasons we would want that to happen? First off, we want to prevent flu. Flu can be bad, no doubt. I mean, coronavirus is worse. There's no doubt about it. But a lot of people do get flu, and we do have big outbreaks. We certainly have a lot of nursing home deaths every year. Not this many, but we do have a good number of deaths. It's obviously, it'll undermine the operation of the schools and the child care centers and all that kind of stuff. So it's its own sort of outbreak thing. So we want to prevent that. But then we throw it together with COVID. There's a lot of sort of negative issues that can happen when they combine. You can get both at the same time. We know that you can have more than one viral illness simultaneously, and so we're worried about what the health effects with that would be. But also, too, you get the confusion factor, right? I mean, what do you have? Do you have COVID? Do you have flu? And then you get seen, and there's that sort of that unknown about how we're going to figure out what to do with folks. So we can take that out of the equation. People will be healthier. And we want to definitely have everybody get their flu shot before the end of October. And I would recommend people going ahead and start getting them now.
I wondered about that because sometimes we hear wait till later and it will last longer, but you clearly said now, as soon
Yeah,
as you
yeah,
can.
now, and certainly before the end of October.
Okay, because there is that period of time between when someone has the vaccine to when it really is an uptake as far as protective factor.
It's about 2 weeks
Okay,
from getting the shot to developing, the proper immunity. So you need that sort of Washington time. But the flu season hits variable times of the year. I mean, it could hit next week. It could hit in 2 months. It could hit in January. And it's hard to time it just right. But especially with COVID going on right now, go ahead and get your flu shots. Starting now is a good idea.
okay, and people can get those in many places across the state. I guess
And
it's more the convenience factor and getting those early on. And you said, I believe you said 6 months of age and older. So virtually everyone except for babies, less than six. And we
and,
also know,
and pregnant women need it too. Yeah.
yeah, okay, and pregnant women as well. So we know from the U.S. Census Pulse Survey being conducted around what COVID is impacts upon households across the country. We know back in the spring and early summer that many people, and particularly children, families with children, were less likely to go in for well child visits or for routine visits. And so some things could have gone undetected. They may be out of sync with their vaccine, regular childhood vaccine. So tell us about how parents can go in and maybe have several things done at once. Is that a possibility?
Yeah, absolutely. Would encourage you to go ahead and if your kid still needs a routine immunizations, go ahead and get those taken care of. Uh, I feel like we're kind of at a little bit of a lull in coronavirus, honestly. I know it's dropped some, but we do expect we'll have another rebound. Um, we reported like 200 and something cases on Monday, 500 yesterday. It's going to be over 700 today. So I don't know that we're kind of starting to head back up, but one day does not make a trend. But we
Right. And
have,
I'll say that this is being recorded for mid-September. So when this drops, those numbers will hopefully be even lower.
we would hope so, um, uh, but go ahead and get your kids taken care of, get their shots done. Um, uh, they're normal shots, but you can get a flu shot at the same time. So
Okay.
go ahead and get everybody taken care of and get your maintenance stuff resolved.
All right. So we know you can't be getting as much sleep now as you did, let's say in January or February, with as long as your days must be. But when you do sleep, or before you have trouble getting to sleep, it's a very personal question. What do you think about? What really, when you leave the office, which is probably few and far between, but when you do, what really worries you, or maybe keep you up at night to think about how Mississippi can continue preventing COVID and other things that are out there in the public health sphere?
I do worry about, I worry about, letting our guard down and getting complacent again. I'm hoping we've learned our lesson from the summer. We've seen the pretty good response we've had. But I also think I know that we, even the public health community, understand that you don't have to shut everything down to turn the COVID curve down, but you do have to do something. And so I just hope we don't lose it. The other thing that worries me, can I talk about anything?
Yes.
I'm worried about medical marijuana on the ballot. I really am. The way that it's been crafted, it's going to open access to marijuana to all age groups. And the way it's crafted, I do worry. We saw in Oregon that when they did something similarly, they had a 6-fold increase in youth marijuana use. And so I'm very concerned about the way us putting marijuana as an enshrined entity within our Constitution with open access that is not subject to regulatory controls. I think that if we do go forward and do that, we're going to regret it.
And as you say, that's coming up soon.
Mm-hmm.
So what would you like to say to other healthcare providers, folks on your team, et cetera, how they've worked and how they've really stepped up here?
It's been a phenomenal experience. It's been hard on folks. We've lost some folks, but we've had some people with not dead. I mean, lost people,
right,
retired or went to another job. But our team has done a fantastic job working. We've just kind of gotten a rhythm. It's not as bad now because we're sleeping every night. For a while, it was pretty hairy. I mean, probably some weeks putting in an unbelievable 110, 120 hours a week, which you think, how could you even do that? And I think about that too. But now it's not so bad. We're still working every weekend, and over time, I think we're down to about 60 to 80 hours a week. But that's pretty tolerable, honestly, in comparison. But we've got our teams assembled. We have really talented people. And the other thing is, I think we feel honored to be a part of the response and able to contribute to making Mississippi a healthier place. But we've got a fantastic team.
Well, thank you for the amazing job you're doing, your leadership, your time today, and to sum up the comments from earlier on the importance of public health generally. It really is an investment, a great return on investment, particularly during these times. You're working across sectors, being accessible, whether that's from childcare to extended care facilities or nursing homes, all across the sector. I've noticed you've been on Twitter, college campuses in between as well. So really using the public health data, using the strengths of public health to help Mississippians, to really help all Mississippians maintain or restore their health using wonderful public health informatics. Tip of the hat to you and your team and for all the great work and information that you've given us. So thank you, Dr. Dobbs.
Thank you so much, Linda. Thanks for having me.